Hello everyone, today we'll discuss about sleep disorders, starting with insomnia. Now, what is insomnia? That is inability of the person to have sufficient as well as restful sleep, in spite of having opportunity to sleep. It is a subjective problem, therefore it occurs either once or so many times in adults. Causes for insomnia: the person may have psychiatric problem, anxiety may also produce insomnia, and alcohol or drug addiction also leads to insomnia. Insomnia can be relieved temporarily by giving sleeping pills, especially they contain benzodiazepines. But prolonged use of these drugs, they can be habit forming and therefore they affect the daytime performance of the individual. Another disorder which is known as familial fatal insomnia. In familial fatal insomnia, the person is having insomnia as well as impaired autonomic and motor functions, as well as the person is having dementia and death. There is neuronal loss or gliosis present in the nuclei of thalamus and medulla oblongata. Next disorder, that is hypersomnia, that is excessive sleep. Causes for hypersomnia, they are brain lesion or tumors. Encephalitis also produces hypersomnia, and myxedema and diabetes insipidus also produces hypersomnia. Another disorder of sleep, that is narcolepsy or cataplexy. What is narcolepsy? That is sudden and uncontrollable urge to sleep. Here, as we have discussed in sleep cycle in adult, the sleep onset occurs with non-REM sleep and which is followed by REM sleep. But here there is sudden onset of REM sleep. So narcolepsy is manifested as episodes of sudden sleep. The individual goes to sleep while performing daytime activity. Another is cataplexy, that is hypothalamic disorder. Here the person is having sudden outburst of emotions and this outburst produces decrease in the muscle tone. In some narcoleptics, profound reduction in the muscle tone that is found, which is known as cataplexy. This is cataplexy. Next is sleep apnea syndrome. Here the person is having attack of apnea. What is apnea? That is temporary stoppage of respiration during sleep. And because of apnea, there is fluctuation in the rate and force of respiration that is found during REM stage of sleep. What is the cause for sleep apnea syndrome? There is decreased stimulation of respiratory center, and because of decrease in the stimulation, there is arrest of diaphragmatic movements and therefore airways are obstructed and the person stops breathing. Various causes for sleep apnea syndrome: they are obesity. In obese individual, because of soft tissues, they compress the airways. In myxedema also the same reason is there, soft tissues they compress. In infants also sleep apnea syndrome is very common, and in cases of brainstem lesion. Another sleep disorder, that is night terrors. It is common in children. The child is feeling uneasiness or discomfort by frightful dreams, and the cause is psychological disturbance, and this sleep terror that is found during REM sleep. Another is somnambulism, that is walking during sleep. The person is having episode of sleepwalking, and this is more common in children than in adults. The episode may last for a few minutes. Here, this somnambulism is present during non-REM stage of sleep, and therefore when person awakes, he or she may not be aware of the events. Such individuals, they walk with their eyes open and they avoid obstacles, and when they awake, they cannot recall any of the event in the episode. You can see here. Next disorder, that is nocturnal enuresis, which is also known as bedwetting. That is involuntary voiding of urine during slow wave sleep, and it is common in children and related with the psychological disturbance. Another disorder of sleep, that is movement disorder during sleep, and this occurs immediately after the person falls asleep, also known as sleep start or hypnic jerk, and it is characterized by sudden jerk of arm or legs Also, other movement disorders include teeth grinding, which is known as bruxism. Next is REM sleep behavior disorder. Here, it is newly recognized condition. In this condition, REM sleep is not associated with decrease in the muscle tone. Instead of that, the person start acting in the dream. So, the person start behaving like he or she is a part of a dream. So, he act out that dream. Generalized or localized muscle contractions, they are associated with vivid visual imagery. Motor response to some of the dream events. It is referred to as hypnotic myoclonia. So this is all about sleep disorders. Thank you.